Almost everything in our world is made up of complex systems. As a decision maker, you need to understand these systems and how they work in order to find the best possible solutions. For example, imagine that you run a hospital with many different departments and personnel, providing services to many patients, using different procedures, medications, devices, and equipment. The hospital is a complex system, and it's connected to other hospitals and healthcare facilities. You can see how making any type of decision involves complex systems of people, processes, and other factors. Without understanding the complete system and how everything fits together, it can be too easy to focus on just one part of the system. Instead of sustainable solutions, you get band-aids that momentarily cover up the problem or even unintended consequences that make things worse. That's why we need system science. System science is the study of complex systems, and its methods help decision makers see the whole picture of a complex system, whether it's the human body, human interactions and behaviors, social networks, an organization, or a community. One way to better understand complex systems is to build a computational simulation model. A computational model can serve as a virtual representation of the systems involved in a decision, process, or situation of interest. When building a computational model, the first step is to map out the entire system. A systems map can show the key parts of the system and how they are interconnected, giving you important insights about how to solve your problem. The next step is to take the systems map and convert it into a living, dynamic systems model so that you can test different scenarios. For example, our team developed a computational simulation model of all 30-plus hospitals and 70-plus nursing homes in Orange County, California. First, we map out the locations of all the healthcare facilities and then created a virtual representation of each one. Each facility had a number of beds, rooms, and units where the patients could stay. Then we created millions of virtual patients with varying sex, age, ethnicity, and different types of medical conditions. These virtual patients moved from the community into the healthcare facilities to occupy beds. Each patient would then stay in the facility for a length of time based on his or her diagnosis, all the while interacting with healthcare workers and potentially other patients. Then the virtual patients would either transfer to a different healthcare facility or get discharged and go home. We used our Orange County model to help design and test different strategies to prevent and control the spread of antibiotic-resistant bacteria, such as MRSA and CRE. Unaided, it's difficult to see how patients are moving, where an outbreak started, and how to prevent the next one. The computational model showed how an infectious disease that starts in one facility can easily spread to others in unexpected patterns. Using this information, we showed how hospitals can improve their outbreak prevention plans by cooperating with other facilities rather than working alone. This virtual systems model led to comprehensive real-world solutions without using the time and resources of traditional problem-solving methods. Health and healthcare are too complex, and the stakes are too high to not use system science in decision-making.